Hello, 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 everyone, and welcome to another episode of Ask Dr. Dansinger with Dr. Michael Dansinger from Diabetes Reversal Experts. He practices in New Hampshire, Massachusetts, and Florida. So if you do have Medicare, you do have that insurance, and you have type 2 diabetes, definitely reach out to Dr. Michael Dansinger and see if he can help you because he's helped a number of our patients with the Global PAD Association lower their A1C and improve their prognosis for peripheral artery disease, which is those leg blockages caused by plaque buildup. And a lot of it is caused by sugar damage to the arteries and the body's response to that. So definitely reach out to Dr. Danziger. I want to bring in Dr. Danziger because today's topic du jour is all about fish. It is at the request of one of our members of the live studio audience, Heinz, and his wife. And we hear all the time, Dr. Danziger, that you need to eat a Mediterranean diet, and fish is a big part of that. But every fish? Do we include shellfish? Do we include the bottom feeders? Do we include farm raised? Like, what type of fish are we talking about here that are healthy? So, first off, Dr. Danzinger, let's just talk about fish and why fish in general for patients who have peripheral artery disease and cardiovascular disease.
Thank you, Kim. Great topic today. Thanks for the opportunity to answer these questions. Fish. Yes.
Fish, it's
Fish.
a funny situation.
Is fish healthy? Yes, but there's some nuances to it. So we're going to dive into that. So yeah, I'm generally very happy when patients are eating fish. Fish has healthy fat in it, the omega-3s, especially the DHA and EPA type of fats, which are in our brains and they're good for heart health. And study after study shows that people who eat more fish are more protected from heart disease or brain diseases like dementia. And so people who eat more fish are at decreased risk of dementia. And we think that the healthy fats in the fish is a big part of it. We often recommend eating fatty fish, especially cold water fatty fish, like wild salmon is just loaded with these omega-3 fats. And I also like the protein in fish. So lean, healthy protein is good, or the protein from fish is good. And fish is a good source of protein. And there might even be things about fish that we haven't learned yet that help keep us healthy. I think a big part of it is because our human ancestors who lived on the shores ate a lot of fish, and I think it's eating fish and seafood is a big part of human evolution, and our bodies are accustomed to it, and so those are all some of the reasons why we see study after study linking fish consumption to health, including heart and brain health and blood vessel health.
And so the big benefits that you want to emphasize, high in protein, but also high in those incredible omegas. And you mentioned salmon as being one of the healthiest fish that is available. It's a cold water fish. But are there other fish that are high in omegas that you would also suggest?
Yeah, so sardines are a perfect
Oh
example.
no. I knew I was going to react to that. My dad loves them. I know people who absolutely love them, but sardines are
Yeah,
just not my cup of
right.
tea.
A lot of people like sardines. They're affordable, they're convenient. Some people have fond, childhood memories of sardines. Other people hate them. So if you don't like them, then you don't have to eat them. But what I like about sardines is they have a lot of healthy fat in them. And trout also has a lot of the omega 3s. And um, anchovies, and
Okay, I could do a Caesar salad. Now you're talking
uh
my.
tuna has healthy fat in it. Lots of different fishes have, most of the seafood has omega-3s in them, but the fattier fish in particular.
Now we have Beth who's in our live studio audience, and Beth is asking about canned fish versus fresh fish. You mentioned sardines. Sardines are big in the can, and we had my dad's dietitian who said, anytime you're having a salad, I want you to open up that can of sardines and I want you to plop them right on top of that salad. Get yourself some more omegas, get yourself some more protein. But what about these canned fish, such as sardines and especially tuna, is another popular one in a can?
Yeah, that's a great question. So in general, canned fish is good, but so canned sardines, terrific, canned anchovies, um, all all of the shellfish that you might see in a can, like oysters, those are fine. And the concern to watch out for is albacore tuna because there's some mercury in it. So if you most of the canned fish people are eating is tuna. So now there's canned salmon, and that's wild salmon. That's perfectly good. But most people go for tuna. And at the grocery store, you'll generally see two qualities of tuna. You'll see the solid white, which might cost about $1.50 a can, and you see the chunk light, which might cost 99 cents a can. And believe it or not, the less expensive um, light tuna is actually the healthier tuna. It has more of the healthy fat and it's lower in mercury. So many people prefer the texture of the solid white albacore tuna, but there's some mercury in there. So the guidelines on the solid white albacore tuna is 1 to 2 cans a week in order to avoid the risk of accumulating mercury over time. Let's talk about mercury. It's an important issue. I think it's the main issue when it comes to fish. So canned tuna is one source of mercury. The other is swordfish. So people like swordfish. Limit that to once per month. If you're pregnant or nursing, don't eat any swordfish and keep your tuna consumption down to, the albacore tuna down to maybe 3 cans a month if you're pregnant or nursing because of mercury. So mercury is a heavy metal and it can accumulate in the brain and the kidneys and the liver, and it can mercury toxicity is rare in people, but it can exist in people who eat too much mercury in their seafood. Again, it's mostly people who eat a lot of canned albacore tuna, or people who eat a lot of swordfish, or tuna steaks. So the tuna in the grocery store is usually ahi tuna. That's a fairly large fish. And so you want to limit your tuna steaks from the grocery store. Those are probably the main sources of mercury in the human diet. And your body cleans out the mercury. So over the course of a year, you can get rid of most of the mercury that's in your body, but it's it's not a real common issue in people. And what it can do though is it can cause some brain cloudiness, and it can cause, in mercury toxicity, we can see some loss of personality, some cognitive deficits, some loss of coordination in children who in newborns from mothers who are eating a lot of mercury from tuna. It can cause brain damage. It's rare, but these are the concerns for mercury, and that's why we limit canned white albacore tuna to 1 to 2 cans a week, and swordfish to once a month.
You can eat the cheap tuna. The cheap tuna in a can is much better.
The
Can you
cheap
have
tuna
more than
can
two cans?
the cheap tuna canned tuna probably has about 20% as much mercury as the more common, more expensive tuna.
So it's interesting because my dad's dietitian, my dad loves swordfish. And he was asking the dietitian, well, so I get to eat a lot of swordfish. And she says, no, actually, again, she agreed with you maybe once a month. But she said that when you are going to consume a fish like swordfish that is high in mercury, to have some Brazil nuts with it because the selenium can actually protect, she said, against mercury toxicity. Had you ever heard that before? So every time he goes out to dinner, he brings a handful of Brazil nuts in a little plastic baggie so that he can consume the Brazil nuts along with his swordfish.
Unfortunately, no, that's not going to do the trick for you. So I love swordfish. It's my favorite fish. And really, just a couple times, just once a month max on the swordfish. The Brazil nuts will not save you from the mercury, unfortunately.
Well, it was a nice thought, at least. The idea was there. What bottom feeders? Are bottom feeding fish like catfish and tilapia actually less healthy than other fish, or is that a myth?
No, those are fine. I think it's just psychological. People don't like the idea of a bottom feeder, but the fish, those are healthy fish, and so um, we just know that eating fish, especially if it replaces unhealthy protein sources like fatty ground meat, is favorable. A big a big question people have is, well, what about farmed? So most of the tilapia that people eat are farmed rather than wild. And what are the issues surrounding farmed tilapia or farmed catfish or farmed salmon? So the wild version of fish is always superior. It just anything wild is going to be better than farmed. But how big of a problem is it to eat farmed tilapia or farmed salmon or farmed catfish? I think it's all right because although it's inferior in terms of its fatty acid ratios, and I prefer the fatty acid profile in wild salmon to farmed salmon. Farmed salmon does have a lot of omega-3, but it has more of the saturated fats as well, which makes it a little less favorable. So there's less saturated fat in the fish than there is like in farmed chicken, let's say, or beef, but compared to wild, the farmed fish isn't as good. But farmed fish, I think, is healthier than farmed chicken or farmed beef. So farmed fish does have healthy protein. People worry that the fish are dirty inside, as if they're swimming in their own waste or
Yeah.
loaded up with PCBs, which are an environmental toxin. And in the early days of fish farming, before as well regulated as it is today, I think it was more of a concern that there's contaminants in the farmed fish. But the um, the you know the the authorities and certification groups have been effective in reducing the contaminants in farmed fish, and I think it's fine. So always wild if you can get it, but I think a lot of the concerns about farmed fish are psychological or environmental concerns. Farmed fish is not terrific for the environment. It's getting better.
So, what about the tuna you get, let's say, off the California coast versus that in warmer waters off of the Hawaii Islands?
So if I understand correctly, tuna swim around a lot and they can go far, but some of them live in the colder waters, and the colder the water, the more favorable the fatty acid profile is in the fish.
That
So
makes sense.
I would always take cold water over warm water if you had the choice. But even the warm water fish, they're all right.
So we're actually looking at some more specific questions about specific fish.
Sure.
We have Beth that is asking about catfish, and we have Marie who absolutely loves cod, and that is all she'll eat is cod. What do you think about those two? Now, cod, most people see cod on their fried fish list. So or a fish stick that you would get in the frozen food section.
Yeah, so cod, you know, so cod is fine. And there have cod does not have yeah, it's it's a leaner fish. It's not as fatty as salmon, for example. And catfish, I think, is probably medium in terms of, fattiness. And the issue is more about, is it breaded and deep fried? I think that's the bigger concern than the fish itself. So if you're eating that fish as, grilled or baked, those fish are often used for fish and chips. And so that's really the bigger issue, I think, is how is this fish, is it battered and deep fried or is it not? So if you batter and deep fry the fish, you're probably negating all of the potential health benefits because you're eating basically fried batter. So
You know what I do for filet of sole is I put on some gluten-free panko, my
yeah,
egg batter, and put it in there, and actually adds a really nice crisp that is a little bit healthier than deep frying, I would imagine. But one of the questions coming in that I'd like to expand further on is the cooking methods for seafood choices. Is there a significant difference between baked, grilled? Well, of course, I mean, fried fish, of course, is probably not even on the list of things that are healthy.
it's a great question. Yeah, so some people might find their fish bland if they don't, you know, bread it. And I think a light coating of breading is, I would call that a condiment. So if you're using a little bit of breadcrumb like panko as a condiment to make an otherwise healthy food more interesting and flavorful, then it's worth doing it. And I think grilled fish is terrific. A lot of in the Caribbean, they often use just a little bit of oil in the pan with onions and peppers and tomatoes and cook it that way. Um, Baked fish is terrific. It's mainly when there's a coating that's saturated in oil that you're starting to miss out on the opportunity.
I love this question that's coming in from anonymous. Of course, it's anonymous. So I love fried foods. Is it better for me to choose fried fish and chips versus just getting fried chips?
What's the lesser of the
Are
evil?
they getting,
Those
I know, are they getting any benefits from
yeah,
the fish at all if it's deep
yeah,
fried?
yeah. So yes, would it be if you're going to have French fries or chips? Is it better to have fish with it? Probably yes. So um, the we're all living in the gray zone a little bit, and we're all eating treats. And I would say, you know, the kind of fish sticks that you get from the package, or the fish fillet sandwich from McDonald's, or the fish and chips that you get. None of that is really what I'm talking about here as being a healthy meal. But is it better than a cheeseburger? Yes. so so it's a middle ground, but really, I mean, what you want to do is be as close to 90% healthy as you can. And you want to have a few treats, and so we're not going to put fish sticks and deep fried fish in the healthy category, but
But if you're going to go to a fast food restaurant, it's better to choose the fillet of fish versus the burger.
It's better to
So
get the salad, but yes.
let's get this. Let's go a step further. Better to get the salad.
But that's not why we go to a
That's
fast food restaurant.
oh, shoot. Um, so we want to talk about if I get French fries with it. No, I'm just kidding. So we're getting questions in multiple questions about shellfish, the shrimp, the oysters, the clams, the lobster. Marie is specifically asking about lobster. Are those healthy options for people with CAD and PAD?
Yes, for people with heart disease and artery disease, yes, shellfish is a good choice. And, we used to be very concerned about cholesterol in the diet. And I think the key issue is, excess cholesterol in the blood clogs up the arteries. But foods that we eat that are low in saturated fat are the healthy ones for the heart. If they have a little cholesterol in them, it's all right as long as they're low in saturated fat. So it's really the saturated fat I'm worried about rather than the cholesterol in the food. So shrimp is a great example. It's low in saturated fat. Shrimp does have some cholesterol in it, and shrimp's probably a pretty good choice for heart health, despite the fact that there's cholesterol in it. Egg yolks are another source of cholesterol um, that can be, well, all right, let's not get into eggs right now, but shellfish can have cholesterol, and lobster has a little bit of cholesterol in it, but it's low in saturated fat. It's healthy protein. Lobsters are wild food, and eating wild food is a safe bet. And so I'd say seafood
Don't
is
dip it
in.
in the butter.
Shellfish is in. Yes, it's the butter I'm concerned about. So if we're using butter as a condiment in small amounts to make a otherwise healthy food more appealing, then I don't have a big problem with it. Should we slather it in butter? No. Should we be um, thoughtful and careful about our unhealthy condiments? Yes.
So, what about smoked fish products from a cardiovascular health perspective?
Yeah, I think they're fine. So,
Lots of salt on a lot of those, though.
yeah, the so smoked foods, all right, smoked salmon, smoked trout, smoked oysters, are they as good as other ways to prepare it? Probably not. So is smoked salmon as healthy as unsmoked salmon? It's not as good of a choice, but still, you're getting all the healthy fats there. I think it's fine. So you don't want to overdo anything, and there is salt in that, so you have to be careful about it. But I think it's fine.
Back to those canned products. Some of the canned products do have different oils and they do have salt in some cases. How do you read the labels to ensure that you're getting the healthiest? And are there ways to make them even healthier, such as maybe running them through a stream of water to rinse off some of the additional oil or salt,
Yeah,
if
that's a
it's
great yeah, that's a great question. So cans of tuna have some salt that's naturally occurring in the seafood. Shellfish have some salt that's in there naturally. It's not excessive. If they're adding salt for whatever reason, then that's not in our favor. And you can wash it off. And then some fish is packed in oil, like olive oil, for example, and some is packed in water. I actually have mixed feelings about those. So if you're looking to lose weight, I think the canned fish you know, I favor the low calorie versions of these things. And if you want to add your own high quality olive oil in moderation, I think that's superior than using the oil that is already in the can. But either way, I think you win with the fish.
Are there any fish or seafood products that you believe should be completely avoided by everyone, no matter what their health status?
I'm coming up empty on that one.
I love that. I
So,
love that.
right,
At
right.
least you're getting some health benefits from every single type of fish that you're out there. At least
I
some
think
sort
I
of.
think so. I think that's good news. And the again, the issue is, be careful not to. I mean, it's a shame that we really shouldn't be eating more than 1 to 2 cans a week of that, solid white tuna. You can't. It is possible to get solid white tuna that's, specifically low in mercury. Instead of $1.50 a can, it probably costs around $3 a can. But there are some organizations that are dedicated to providing low mercury tuna. And so you can look for those in certain grocery stores. So if you'd like to pay double to make sure your mercury is low, that's fine. Or you can just buy the cheap tuna, which is already low in mercury.
Well, this one doesn't make me too happy as one of the final questions here. Beth is now asking about turtle, and that reminds me there are also frogs that are in the amphibian family.
So turtles are wild, frogs are wild. I think the meat in there is healthy. Now, I'm just guessing. So I don't you've taken me to the edge of my nutritional knowledge when it comes to the healthiness of turtle meat. I think turtle meat is healthy. I don't think it's particularly high in mercury. I don't think it's um, I think it has a favorable fatty acid profile. And frogs, same deal. So I think these are fine to eat. If people ate more of, turtle and frog, or really any other wild meats, I think it's better than the chicken and the beef and the pork that we're eating. So wild is always in.
Yeah, there has been some concerns that I've read about just the contamination of the waters, where turtles are, and while they're great in protein, less fat, they might not be the healthiest of all options that are available in the sea.
I'll have to look into that more. Okay.
So we really appreciate you. Just as we summarize here, what are some guidelines? Someone is going to the store, someone's going to a restaurant. How do they choose if they want to choose the healthiest items to put in their shopping basket or on their plate at the restaurant?
Yeah, at a restaurant, fish is generally a good choice. And, you want it, baked or grilled if you can with the vegetable and, fish, some people say never get fish at a steak place, but because that's not why you go there, but you can get the fish at the steak place. And, um,
Well, you can get the steak and lobster. You could do surf and turf.
yes, you can. So fish at a restaurant is one of the better choices in most cases. And when you are at the grocery store, um, if you don't come home with wild fish, I think you're missing an opportunity to eat better. And often the price is limiting us on the wild fish, but it's delicious. And if you learn how to make it well, you're in for a treat. So those are my bits of advice on that.
But as you've said earlier, and Monica is now asking again about, is the fact that sardines are wild and you can get the wild fish in a can and it can still be just as healthy as having the fresh wild fish you would get in the outer aisle of the supermarket.
Yes, that's a really good point. Yes, good point. Sardines in the can, always a winner. And if you can learn how to have it in a way you enjoy it, that's a great opportunity. Thank you for that tip.
Thank you so much, Dr. Dansinger. And as we head off, let people know how they can find you. I know that they can follow, make sure they subscribe to your YouTube channel, youtube.com/the @ Michael Dansinger,
MD.
MD. So make sure you follow him there. And what's your website, Dr. Dansinger?
So the website is diabetesreversalpartners.com. And as you mentioned, I'm in Massachusetts and Florida, New Hampshire, and now I'm in Minnesota and Virginia.
Oh, you did. You actually got those, Minnesota and Virginia. That is fantastic.
And
So, Minnesota, Virginia, New Hampshire, Massachusetts, and Florida. If you have type 2 diabetes, make sure if you do have Medicare that you reach out to Dr. Michael Dansinger for assistance in bringing down that glucose, which is so important in preventing complications for type 2 diabetes, which include cardiovascular and